That bone health supplement on your counter may be putting extra pressure on your kidneys right now. After 65, the same pill meant to protect you can quietly backfire if you take it the wrong way. If you want to stay healthy and independent as you age, hit that subscribe button right now. We share simple, science-backed health tips like this every day, and the next one could save you a lot of trouble. Over the years, doctors have seen the same pattern again and again. Good people try to do the right thing. They take calcium every day for their bones. But later, some of them end up with kidney stones, high blood calcium, or blood tests showing their kidneys are under stress. That does not mean calcium is bad. It means the form, the dose, the timing, and your personal health all matter. And by the end of this video, you'll know exactly how to protect your bones without putting your kidneys in the line of fire. Now, before we continue, tell me your age and where you're watching from in the comments. This helps us understand who we're helping. Here's what most people get wrong. They hear calcium and think more must be better. Or they hear kidney stone and think all calcium is the enemy. Neither one is true. Not less calcium, but smarter calcium. That's the real message. Your body treats calcium from food and calcium from a pill very differently. Food calcium comes in slowly. It shows up with protein, fluids, and other nutrients. A big supplement dose can hit your system like a truck at once. If your body does not need all of it, some of that extra calcium can spill into your urine. And that is where trouble can start. Have you ever thought about that? A 2021 review from the University of Naples, Federico II found that calcium taken during meals lowered urinary oxalate, which is a natural substance that can join with calcium and form stones. But calcium taken away from meals raised urine calcium without the same benefit. That same review also highlighted a large trial in postmenopausal women where calcium plus vitamin D was linked to a 17% higher risk of kidney stones. So the problem is not always calcium itself. The problem is often how you take it. There is another fact that shocks people. A 2024 review in Frontiers in Nutrition noted that more than 80% of kidney stones are calcium oxalate stones. That sounds like calcium must be the villain, but it isn't that simple. Calcium from food can actually help trap oxalate in your gut before it reaches your kidneys. Strange, right? The wrong calcium can raise risk, the right calcium can lower it. So let's break this down in the simplest way possible. Here are the 5 biggest ways this healthy supplement can start hurting your kidneys after 65. Number 5, taking too much at one time. Most people think one big pill is easier, but actually one big dose can be harder on your body. Your intestines do not absorb unlimited calcium at once. Your kidneys then have to deal with whatever your body cannot use. Think of it like pouring a gallon of water into a small funnel. Some goes through, the rest backs up and spills over. The National Institutes of Health says most adults over 70 need about 1,200 milligrams of calcium a day. The upper safe limit for adults over 51 is 2,000 milligrams a day. That includes food and supplements together, not the pill alone, the total. And that is where many people get into trouble. They take a 1,200 milligram supplement, then drink milk, eat yogurt, and use calcium-fortified foods. Suddenly, they are way over the line without knowing it. Look at your bottle. Does it say calcium carbonate or calcium citrate? Then look for the words elemental calcium. That is the amount that counts. If one serving gives you 600 milligrams or more, do not assume bigger is better. Many doctors suggest splitting calcium into smaller doses, often 500 to 600 milligrams at a time, instead of swallowing a whole day's worth at once. Why? Because smaller doses are easier to absorb and less likely to flood your urine with extra calcium. What should you do tonight when this video ends? First, add up your real daily total. 1 cup of milk has about 300 milligrams. 1 cup of plain yogurt has about 300 to 400 milligrams. 3 ounces of canned sardines with bones have about 325 milligrams. Half a cup of calcium-set tofu can have 250 to 400 milligrams. 1 ounce of cheddar cheese gives about 200 milligrams. See how fast this adds up? If you are already getting 700 to 900 milligrams from food, you may not need a large supplement at all. Maybe just a small one, maybe none. That depends on your diet, your bones, and your doctor's advice. But do you see the mistake? Many people are not low, they are overloaded. And one more thing, drink water with your calcium. Not soda, not just coffee. Water helps dilute your urine. That makes crystals less likely to clump together. Simple step, big payoff. Quick question. Have you ever had kidney stones, side pain, or painful urination after taking supplements? Comment yes or no below. Number 4. taking it at the wrong time. Most people think timing does not matter, but actually, timing can change what happens inside your body. This is one of the biggest hidden mistakes. Here's the thing. Oxalate is found in foods like spinach, nuts, beets, chocolate, and sweet potatoes. When calcium is in your gut at the same time as oxalate, they can bind together there. That means less oxalate gets absorbed into your blood and less reaches your kidneys. But if you take calcium between meals or at bedtime, you may miss that benefit. A 2021 review from the University of Naples Federico II described a crossover study where calcium taken during meals lowered urinary oxalate compared with bedtime calcium. That matters because urinary oxalate is one of the raw materials for kidney stones. In plain English, your supplement works best when it shows up where the problem starts. So if your doctor tells you to take calcium, take it with food, not on an empty stomach. Breakfast or lunch is usually easier than bedtime. Why lunch? Because many people eat more oxalate-rich foods later in the day. A sandwich with cheese, yogurt with lunch, or tofu in a meal can help more than a pill by itself at night. And do not chase your pill with a salty meal. High sodium means high salt. Salt makes your kidneys leak more calcium into the urine. So a calcium pill with canned soup, frozen dinners, deli meat, or fast food is a bad combo. The National Kidney Foundation warns that high sodium can push more calcium into the urine and raise stone risk. Not just the pill, but the pill plus salt. See the difference? A better routine is simple. Eat a meal. Take calcium if you truly need it. Drink a full glass of water. Keep the salt lower. That is it. No fancy hack, no miracle powder, just better timing. But wait until you see number 3, because this is where many bone health plans really start going off the rails. Number 3, stacking it with vitamin D without checking your labs. Most people think calcium and vitamin D are a perfect pair, and sometimes they are. But sometimes that pair is too strong for your kidneys. Vitamin D helps your body absorb calcium. That sounds great. But if you already have enough vitamin D, or you take high doses, you may absorb more calcium than you need. That can lead to hypercalcemia, which means too much calcium in the blood. It can also lead to hypercalciuria, which means too much calcium in the urine, and both can be hard on your kidneys. A 2024 study from the University of Heidelberg looked at 445,493 adults in the UK Biobank. It found that regular vitamin D supplement users had 46% higher odds of hypercalcemia. That does not mean vitamin D is always dangerous. It means combining supplements without checking your real needs can create problems fast, especially after 65, when kidney function often slows down a little, even in healthy people. This is how it happens in real life. You take a calcium pill, then a vitamin D soft gel, then a multivitamin, then maybe a bone support chew, then maybe an antacid with calcium. Every product seems harmless alone. Together, they can turn into a chemistry set. Before we go further, if this is making sense so far, hit that like button. It tells me you want more videos like this. So what should you do? Ask for 3 simple things at your next visit if you take both calcium and vitamin D regularly. Ask about your blood calcium. Ask about your vitamin D level, often called 25-hydroxy vitamin D. And ask about your kidney function. If your doctor says your levels are normal, you may not need a high dose at all. Let me be clear. More is not always better. More can just be more. Also, read your labels closely. Many bone supplements already contain vitamin D. Many multivitamins do too. Some fortified drinks add even more. If you do not add it up, you are guessing. And guessing is not a good plan when kidneys are involved. But number 2 is even more personal, because it may apply to you even if your dose looks normal on the bottle. Number 2, ignoring your medicines and your kidney history. Most people think supplements sit in a separate box from medicines, but they do not. Your kidneys do not care whether something came from a doctor, a drugstore, or a health food aisle. They still have to process it. If you have ever had kidney stones before, your risk may already be higher. If you have chronic kidney disease, which means long-term loss of kidney function, your kidneys may struggle more with extra minerals. If you get dehydrated easily, deal with frequent constipation, or take water pills, your risk can climb even more. Did anyone ever explain that to you clearly? The NIH fact sheet on calcium lists important interactions. Calcium can interfere with some antibiotics, especially quinolones like ciprofloxacin. It can block your thyroid medicine from being absorbed. And some people take thiazide diuretics, often called water pills for blood pressure. Those drugs can reduce calcium loss in the urine, which may sound helpful, but in the wrong setting, they can also push blood calcium too high. This is why two people can take the same supplement and get very different results. One person is fine, another gets nausea, constipation, weakness, confusion, or a kidney stone. Same bottle, different body, different kidneys, different outcomes. So here is your safety checklist. In plain English, if you take levothyroxine for thyroid, keep calcium at least 4 hours away unless your clinician says otherwise. If you take certain antibiotics, ask the pharmacist how far apart they should be. Many need to be taken at least 2 hours before or after calcium. If you take a blood pressure water pill, ask whether your calcium dose still makes sense. And if you have had kidney stones before, do not self-prescribe big calcium doses just because the label says bone health. I'd love to hear your story. What made you click on this video today? Share in the comments. And now the most important one of all. Number 1, believing a pill is safer than food. This is the big one. Most people trust the bottle more than the plate. But for calcium, food often wins. Harvard doctors have pointed out that calcium from food does not carry the same kidney stone concern seen with high-dose supplements. The National Kidney Foundation recommends 1,000 to 1,200 milligrams of calcium a day for many adults who need it, ideally through food with meals. Not random megadoses from a bottle. Food gives your body a slow drip. Pills can give your kidneys a wave. Think of food calcium like paying your bills one at a time. Easy to handle. A large supplement is like dropping every bill in the mailbox at once. It creates pressure. What does a food first day look like? Breakfast could be 1 cup of yogurt, around 300 to 400 milligrams. Lunch could include 1 ounce of cheese, about 200 milligrams. Dinner could include 3 ounces of sardines with bones, about 325 milligrams, or calcium-set tofu, around 250 to 400 milligrams per half cup. Add a cup of milk, about 300 milligrams if you use dairy. Suddenly, you are close to your goal without one giant pill. And if dairy does not work for you, no problem. Try calcium-set tofu, fortified soy milk, canned salmon with bones, sardines, low oxalate greens like bok choy, or lactose-free yogurt. You still have options. Budget matters too. A tub of plain yogurt, a carton of fortified milk, or canned fish often costs less than fancy supplements that promise the moon. Look, I am not saying nobody should ever take a calcium supplement. Some people do need one. Some people eat very little calcium. Some have osteoporosis. Some have special medical reasons. I am saying this. If food can do the job, it is often the gentler and smarter place to start. Let's pump the brakes for a second. I'm not saying this to scare you, but you should know the warning signs. If calcium or calcium plus vitamin D is too much for your body, you may notice constipation, nausea, poor appetite, belly pain, more thirst, more urination, or feeling unusually weak. A kidney stone may cause sharp side pain, blood in the urine, or pain when you pee. High blood calcium can also cause confusion, fatigue, or a foggy feeling. Those are not normal aging symptoms. They deserve attention, and some people need more caution than others. If you already have kidney disease, a history of stones, high blood calcium, hyperparathyroidism, or you take several medicines, do not guess your dose. Talk to your doctor or pharmacist. If you suddenly get severe side pain, vomiting, fever, or blood in the urine, get medical help right away. Don't wait it out. So, you're convinced but thinking, how do I actually do this? Make it easy. Start with the simplest move first. For the next 3 days, do not buy anything new. Just check what you already take. Add up the calcium in your supplement, your multivitamin, your antacid, and your food. That one step alone can open your eyes. Second, aim for food first. Try to reach most of your calcium through meals. If you still fall short, ask whether you need a small supplement instead of a large one. Third, if you do take calcium, take it with a meal and water, not on an empty stomach, not all at once. Fourth, keep your salt lower. Salt pushes more calcium into the urine. Fifth, if you use calcium and vitamin D together, ask for simple blood work. That is not being dramatic. That is being smart. If money is tight, keep it basic. Store-brand yogurt, milk, fortified soy milk, canned salmon, sardines, and tofu are usually cheaper than premium bone formulas. You do not need a trendy powder. You need a plan that your kidneys can live with. Look, there's a lot of noise out there. One person tells you to take more calcium. Another tells you to avoid it completely. The truth is calmer than that. You do not need to overthink this. You need the right amount in the right form at the right time for your body. Start with just one step today. Read your label and add up your real daily calcium total. That's it. Your body will tell you if it's working, and your labs can confirm it. Strong bones matter, but healthy kidneys matter too. You deserve both. If this helped you, hit that like button. And if you want more videos like this, make sure you're subscribed because we post new health tips every single day. Stay healthy, stay strong,